you should think that the activities of the Corrections Department are helpful to society. If the prisoners who have not been well trained are released, they will return to be gangsters and do harm to society again. Corrections officials should be proud if you can train the prisoners to be good citizens. I wish corrections officials have patience in training and fixing the prisoners. Also give them some skills that they can use for legally make a living. Once they are released, you should follow up on how they can make a living out of those skills. Royal Address of His Majesty King Bhumibol Adulyadej. In Thailand, some people experience inequality in healthcare, which is rooted in a lack of political, social, and economic power. Most of such people are women, children, the aged, displaced people, ethnic minorities, inmates, people with disabilities, people suffering from chronic illness and conditions. Vulnerable populations are defined as those at greater risk for poor health status and healthcare access, and those without adequate potential access to care. Social and health support to female inmates, an example of how Her Royal Highness Princess supports the justice in female inmates. These pictures might be strange sights for outsiders, as they have never thought that such things would happen in this place. This is the Ratchaburi Central Prison in Ratchaburi Province, Thailand. Today, a training program for mothers and child caregivers is being carried out in the prison by health personnel from outside the prison. The training is one of several health activities that are undertaken in prisons in Thailand. Central Prison Ratchaburi, Mr. Amnat Pratyapan, Prison Warden, Central Prison Ratchaburi, said, "In taking care of female prisoners, we have to follow the Bangkok rules as adopted by the United Nations in order to give special care for special groups of women, such as mothers and children, according to their basic needs with no discrimination against age, race, and nationality. We have a concept for getting them prepared before releasing them to society and helping them to have strong physical, mental, and thinking capacity according to our motto, physical, mental, and thinking capacity." For Thailand, statistics from the Corrections Department, Ministry of Justice, show that of all 289,675 prisoners, nearly 40,000 are females, whose health problems are mostly respiratory tract, obstetric, gynecological, dental, and mental illnesses. So Thailand is aware of such problems and has set up health care guidelines for such prisoners, in collaboration with all relevant sectors. For female prisoners, when they are sick, primarily a healthcare facility or frontline medical unit in the prison will provide medical care, including physical examination, screening and treatment, and coordinate referrals to other healthcare facilities of the Ministry of Public Health, for the cases with illnesses that are beyond the capacity of the prison's medical unit. Mrs. Ampan Ratchaburi, Chief, Female Prisoners Control Ward and Nurse, said, "We have to take care of female prisoners, focusing on disease prevention and control and illness treatment. Upon coming into the prison, we have to check their healthcare eligibility so that whenever they get sick, they will receive medical treatment according to their rights. If they have a chronic illness, they have to receive medication continuously. We have a healthcare network with primary, secondary, and tertiary care settings." Besides, other important duties of the prison's medical unit also include health education, specific disease treatment, disease control and prevention, and health promotion. Many health activities are organized for prisoners to take part according to their interest and ability. Meanwhile, the provision of specialty healthcare is also important. For instance, today, this dental clinic is regularly set up for female prisoners with dental health problems. At the same time, maternal and child health problems are a rising concern in Thai society, as evidenced in the establishment of the Kamlang Chai project, under the royal initiative of Her Royal Highness, Princess Pachara Kittiyapa, who has been interested in improving the health conditions of imprisoned mothers. The project has set up a separate mother and child care facility with activities related to maternal and child health promotion, and ensures other rights eligibilities as necessary as shown in this prison. This female prisoner said, "I was initially in jail when I was 8 months pregnant. I was then worried, but after being in prison for a while, I found that I was given a good care. I have been educated about maternal and child care, including food, which is very useful. When my baby was 1 year old, the baby was taken out of the jail for care at home by my relative. For myself, I intended that for a little over a year in jail, I will continue learning and take a course on embroidery so that I can work after getting released." When the physical health has been systematically taken care of, prisoners' mental health also needs to be addressed. Here, there are several activities, but importantly, there must be some preparedness actions for prisoners who are about to finish their jail sentence to cope with the outside situations, which have changed with time. Giving them some knowledge and various vocational skills is the basic immunity for female prisoners. This female prisoner said, "I like this place as I can join and learn many activities that make me unstressed. I am an unhealthy and old person. Even before being imprisoned, I was worried about my health. It would be nice if there was a doctor on duty or a nurse, which could make me confident if I had an emergency and I could get emergency treatment." However, the care for female inmates in various dimensions is problematic, practically because it requires coordination with several agencies, both within and outside the Ministry of Justice, which have legal and practical constraints. For example, the lack of thorough and timely medical and health services due to inadequate personnel in relation to the large number of prisoners. Dr. Chu Chai Son Chamni, Deputy Secretary General, NHSO said, "In the process of providing healthcare for female prisoners, we use a multi-sectoral effort with different healthcare benefits. But we have a problem of verifying prisoners' healthcare eligibility using the 13-digit in their ID cards. But 1/5 of the prisoners do not want to show their eligibility due to several reasons, resulting in inaccessibility to healthcare. Over the past 2 years, the NHSO has signed an agreement with the Corrections Department and the Ministry of Public Health to allow flexibility for the cases whose eligibility cannot be verified."
ป้องกันโรคและก็รักษาที่ดีครับ
At present, guidelines for resolving such problems have been jointly drawn up and issued as a Cabinet's resolution of 2015, which require that all relevant agencies improve ways to develop healthcare systems for prisoners and revise laws, policies, and practical procedures so that they are consistent with each other and will result in better health of prisoners in the future.